There's often been quite limited training and education in MSK. There's lots of secondary care teaching out there that we can do, but it doesn't really often apply to the sorts of things that we see really. So today is very much a hope that you feel that we're all working GPs, that we're going to teach you skills and techniques that actually you'll be able to use in the real world.
We know that musculoskeletal problems are really common in general practice, and often people feel underconfident or don't have the right teaching to deal with them in a sort of systematic way.
And the problem with a lot of traditional teaching is it hasn't really helped us as healthcare professionals to do the important and good quality things in the real world.
As a result, patients have probably been slightly shortchanged by GPs over the years. There's an increasing awareness that with it being so prevalent within the community, with increasing age of the population, etc., that we need to address that imbalance. And GPs, I believe, do recognise the problem, are very keen to develop their skills so they can provide a better service.
We're really hoping that each one of the delegates is going to come away today with some real practical knowledge and skills that they can apply in day-to-day practice.
I came to the course today because I was keen to build on my confidence around musculoskeletal conditions and really be able to find the language to discuss the conditions with my patients in clinic and give them some really practical and pragmatic advice there and then, rather than always reaching for blood tests or x-rays or sending them to physiotherapy.
A lot of the work that we do, from the time that we qualify to becoming a GP, some of the core skills we lose along the way because we've become so streamlined. And so coming to workshops like this really help us refresh those skills that we learned early on, and sometimes also help us hone those skills, make them kind of more focused and more powerful so we can give the best to our patients.
It's quite difficult to fit in the consultation regarding musculoskeletal symptoms in a 10-minute GP consultation.
Sometimes it's easy to be a bit bamboozled by the number of examination techniques there are. So I wanted to just really know that I was doing a good examination.
It's a great way of building your own confidence.
And there are always things you can learn. It's a lifelong learning process.
So classically, obviously, we'll be presenting some information in large group formats, and then the key feature is that we then break into smaller groups and the delegates get a chance to look at individual areas in depth and also to practice the skills in real time. So it's a real hands-on experience.
Although we've gone through a whole range of training to get where we are today, we have an obligation to constantly update and improve our skills as part of our annual appraisal and part of our professional development. So there are both obvious gains to learning specific skill sets in a workshop format. There's also the tacit learning that goes on. So the opportunity to learn together in a collaborative format in these workshops is a great chance for us to learn. And that's true for us trainers as well as the delegates.
I have learnt so many new ways of taking the consultation. In some ways had to declutter some of the things that I've been doing in the past that in fact probably aren't that beneficial within the consultation or the examination. So it's really refining what do I need to do to be an efficient doctor, but hopefully a good, caring and, of course, evidence-based doctor in helping patients with long-term MSK conditions.
So if healthcare professionals just take one thing away from attending the workshop and the course, my hope would be it would be around confidence. And what often goes with confidence is enjoyment.
Since coming to this workshop, there have been general changes that I'll make to my consultations with patients around their musculoskeletal conditions. Most of all, again, it's about my confidence in being able to diagnose them and give them practical advice about what to do.
I think moving forward from today, I would definitely have a much quicker but very comprehensive back and lower limb examination, and I have completely changed the way I examine knees.
Taking from what I've learned so far moving forward would be to look at how I communicate with patients, because I think a lot of the time the language that we use unfortunately can be slightly damaging. I mean, the first one that jumps to mind is the word degenerative. Changing that to say something like change with age or these are age-related changes can be a lot less damaging to patients.
Making a decision with the patients, I think, realising what their expectations are and meeting that demand.
Also talked about positive ways to feed back to them without needing investigations, tests and all these different ways of treating patients which isn't beneficial for them or anyone.
One thing that I'd like healthcare professionals to take away from today is that it isn't as complicated as you think.
It's that actually we can do less, but we can do it better.
I have learned that I can actually be simpler in my examination technique, which is a really great relief.
One of the things that I will definitely take away is a much slicker way of examining. I feel like I'll have shaved off a lot of faff from my examination techniques.
I'll definitely be recommending this course to my peers and colleagues because it's been a really rounded package of information, practical advice and resources that I can take back into my clinical work. But also it does offer 12 credits that are matched up together for your CPD learning, which is a great addition to any single year's appraisal, and all of the resources it also leads into so that you can add them to your clinical repertoire once you're back in practice.
It's a really good opportunity to have small group learning. Yeah, really important topic, really well delivered.
It's an essential program for any GP that wants to, do the best for their patients.
All the trainers here who felt their experience in musculoskeletal have learnt an awful lot, and we've all changed our practice, in fact simplified our practice. So I'd encourage everybody to think, come here, it will change your practice to help your patients.